Welcome to the State of Health. I'm your host, Karen Bowling, Cabinet Secretary of the West Virginia Department of Health and Human Resources. Recent historic flooding left many communities in a state of complete devastation. Here are some of the scenes taken by the West Virginia National Guard aboard a UH-60 Black Hawk helicopter soon after the waters receded. The pictures show incredible widespread destruction left by the raging floodwaters. With 23 lives lost and more than 1,000 homes destroyed, the work of countless agencies and volunteers continues as we rebuild West Virginia. In today's show, we'll look at how this disaster was handled on the state, local, and national levels. Through all of this, protecting our health during cleanup has been a key to preventing further tragedies. Joining us to talk more about this is Dr. Rahul Gupta, State Health Officer and Commissioner for the Bureau for Public Health. Dr. Gupta, thank you for being here.
Thank you for having me, Madam Secretary.
You know, I know major floods like this it's a natural disaster, and we never know when this is going to hit. How do we prepare? What do we do in terms of our DHHR's emergency response so that we can be ready to help our communities in need?
Certainly, DHHR does a number of activities on a daily basis in order to prepare. We work through the Center for Threat Preparedness, which itself works with the Homeland Security at the state level and with the various federal partners like the Centers for Disease Control and Prevention. And the idea here is to have prepared activities, know how to react, have a collaboration between various agencies and partners across the state, from a federal level, state level, as well as local level. So we are working every single day from Bureau of Public Health, from DHHR, at the Center for Threat Preparedness to ensure that we are as prepared as one can be in order to respond when that time comes. Unfortunately, it did this time around.
You know, I think people probably don't realize that this is a 24/7 operation. I think sometimes people think of state government as, you know, an 8 to 5. What happens when there's an emergency? How do we ensure that there's always someone available for our communities that are in need? What is it specifically that our command center does for in terms of health?
Sure. To maintain that attentiveness, one of the things that happens is for reasons sometimes definitely in a state of emergency, but sometimes otherwise too when there are local disasters, what we do, the first thing to do is a stand-up command. When that happens, our Center for Threat Preparedness goes into an active mode, a 24/7 active, when you've got somebody there monitoring, usually more than one person, and they're looking at all aspects. They're looking at health centers across the state or that impacted area, meaning hospitals, nursing homes, clinics. They're working closely with local emergency managers, local health departments, and a number of other facilities and partners at a local level, providing resources in order to impact and provide what's needed when and where in a very real-time manner in relation to health and medical needs of that community.
You know, I know that, we have great folks who do wonderful work here and that we coordinate closely with emergency management. Another thing that occurred during this flood event, as just one example, is people were concerned about water, about safe drinking water. How do we ensure that, if there is a water system impacted, that we get the word out and let people know exactly what's going on in their community as it relates to that?
That was a wonderful demonstration of the work of Center for Threat Preparedness. One of the things we saw was almost 24 water systems had become impacted by the water, as well as evacuation of several nursing homes. And we brought them, or we helped bring them online very quickly. Some of them were functioning while the damage was being evaluated and fixed at the same time. So we wanted to make sure that we can do a quick assessment of the water systems and then make sure that those who can get back online safely do so in a very expedient manner. So one of the things that happened was the success of that coordination, because one of the things that is required in a time of emergency is to ensure there's a proper coordination of the resources you have, both local level as well as state and federal levels. And so a testament to the Center for Threat Preparedness and Homeland Emergency work was that we brought those water systems back into as quickly partnering with our local folks.
And I know that we also distributed water because there were water systems that were down, and at the same time there were, medical facilities that needed water, and so that took everyone working together, correct?
Absolutely, and that is an important part, whether it is your EMS agency, whether it's your fire department, emergency management, local health department, or some of the other communities and nonprofits across the state. We all come together in that time, and whether it's distribution of water or making sure the nursing homes or facilities are being evacuated in a timely and orderly fashion. One of the things we saw with this flood was that some of those facilities were damaged, and those individuals had to be we had to find placement for them. So that also happened as an act of coordination, happened rather quickly to make sure that our most vulnerable populations are placed back into safe facilities.
That is so important. I know that there are health risks. I mean, as the state public health officer, we're worried about that during flooding.
Absolutely.
And I'm sure that our viewers would be very interested to know, one, what are some common health issues that we face during a disaster such as a flood, and what is it that we need to do, and how do we educate our public to ensure they know what are the things that they should avoid, or what procedures should they put in place to ensure we don't transmit disease, which would be, of course, another very serious issue for our state.
Correctly, very, very, very true, because when we have outage of power, it's important that when you are watching over your food, for example, that you want to know when food is safe to eat, when it's not safe to eat. You want to make sure that when you are impacting those utilities that get flooded, that you get some really certified professional help, because that could be a dangerous. Same thing with when you are thinking about doing a number of other things, for example, heating and cooking food. Sometimes we've had some instances of carbon monoxide poisoning, especially when you're burning stove inside the house. And then there's some precautions like making sure that your shots are up to date, making sure that you're taking every safety precaution when you are cleaning and doing the cleanup of the efforts that you're doing, including saw chain. And it is that information that needs to be spread out that we did as DHHR this time around in a timely manner that helps save lives and reduces the impact of negative things. So flood is one thing, but the impact afterwards we often see is people get injured, they get hurt, or they are having carbon monoxide poisoning, and other things can also happen. So we work very closely with our emergency responders on the local level to ensure that that information was being transmitted in a timely manner.
If someone's interested, just to close, in learning more about what precautions to take, they should see our website, because we lay all that out on our website.
Absolutely. All of that information is available on our website.
Great. Thank you very much, Dr. Gupta. Appreciate the work and your team's work on this disaster and how we've pulled together.
Thank you for having me.
Still to come, a look at how DHHR county offices handled the torrential rains. Stay with us.